So, thank you everyone for coming here tonight. Well, not today, sorry. It's been a long day coming this afternoon. Really excited to have this discussion with everyone here and really excited to just hear everyone's insights about these topics that we'll be discussing today. So, welcome to the Let's Talk About Sex, Healthy Relationships, and Positive Sex panel discussion. All right, so before we begin, I'll introduce myself. My name is Eve, and I'll be the moderator for this event. Joining us this afternoon, we'll have a panel of our sex, health, and relationship experts who will be answering questions asked by students like us. So the first person I would like to introduce is Dr. Martin Dragon. Did I pronounce that correctly? Okay. Who is a clinical sexologist, educator, and lecturer who teaches at Brock University. So I'm sure some students have probably seen him before, which is pretty awesome. So Dr. Dragon, do you mind sharing what a sexologist is and what the work entails?
Sure. Sexologist, someone who's had some training talking about sex, I guess is the simplest way to put it. But rather than just sex therapy, traditionally sexology involves a couple of other things too. We dove into things like art history, anthropology. So really how we study sexual expression, sexual behavior, sexual health, kind of encompassing just all these different elements. And as far as, what I ended up doing and what I ended up specializing in was clinical sexology. So essentially what like a sex therapist would be.
Very interesting. And from my understanding, you also teach anatomy at Brock University as well?
Yeah, started off as a side gig and now they can't get enough of me. So I'm the senior lab demonstrator. Just some of the work that I've done in the past, I did some medicine and stuff. So I ended up being part of the anatomy program. And yeah, so I'll teach some sessional courses every now and then. Usually it's the human sexuality course, whether it was in psych or in health sciences. And now they've got me doing some of the anatomy work. So I'm usually around campus if it's not, a pandemic, but otherwise it's mostly working from home now.
Oh, nice. Very interesting. Do you plan on implementing anatomy and your research in sexuality, or do you plan on doing crossovers between the two in the future?
I do plan, because there's a lot of really interesting things, at least for me or in my mind, when it comes to both. And that kind of involves some of the physiology between things. So Dr. Bogart has like an actual sexuality study lab just sort of around the corner from my office. So I've got like a ton of ideas that we could potentially do. So it's just a matter of trying to, put everything down and get it organized. But there's always something brewing. But yeah, there's a ton of overlap we could potentially do. So I'll get there eventually.
Oh, that's pretty cool. Well, we're all looking forward to that. So, we'll be hearing more about Dr. Dragon and his insights as we continue with this panel. I'd also like to introduce our second panelist, who is named Heather Whalen, who is a nurse practitioner and is passionate about women's health and preventative care. Hello, Heather. Do you mind sharing more information about your job description and what you enjoy most about your job?
Sure. I'm just going to pause my video. I apologize in advance. It does keep freezing, so I'll keep it off. I just wanted to show everyone my face. So I'm a nurse practitioner at Student Health Services. So my role there involves seeing patients for a variety of medical concerns or mental health concerns. So similar to visits that a physician would see. And I really enjoy working with the team there and working with the student population. I learn from my patients and students all the time, so it's been really enjoyable.
Wow, that's awesome. Well, I'm definitely looking forward to hearing your insights as well from a nursing perspective. And I would like to also introduce our third panelist. I'd like to introduce Kellen Best, who is our gendered and sexual violence peer-to-peer support member at the Brock University Human Rights and Equity Department. Hello, Kellen. How's it going?
Hanging in there.
That's good. That's good. Do you mind telling us more information about your job description?
Yeah, absolutely. So I'm a part of the sexual violence support and prevention aspect of the Human Rights and Equities office at Brock. So we're responsible usually for event planning and programming as it relates to gendered and sexual violence. delivering workshops. And we also have a drop-in center where we can sort of provide one-on-one peer support, be it, in a moment of crisis or just to get more information. It's really, we're just there as an option for people in case they would like more information of how to sort of navigate their experiences, or even like this topic that can be really difficult to talk about.
Awesome. Well, thank you. We look forward to hearing your insights as well, especially from a peer perspective. I'm going to go into describing what the event is really about, but before I start, I would just like to turn our attention to the chat. So our facilitators have dropped in a few links in the chat to have for students to use. For example, for the first link, just so people are aware, this event is going to cover topics related to consent and sexualized violence. So if you do start feeling a little bit uncomfortable or need some support, just click on the link in the chat, and you'll be able to get some support from an HRE person. Also, if you guys, I know I see a few students here during this session, if you don't want to ask questions up front, you're more than welcome to click on the link and send in your questions anonymously, and we'll be able to get to them during this panel. And also, this is also a CWC credit. So if you guys want to earn that credit for joining a workshop on like health and wellness, also click on the link in the chat as well, and you'll be able to fill in your attendance. And if you also want to discuss these concepts further, or just want to have just be able to talk to us more about it, we also have another link directing us to the HRE website, so you can be able to contact us and join us in our drop-in sessions that happen weekly. So that's just information for the guests here. So I'm just going to kind of jump into just kind of the background of this event so that we can be, aware of what's going on. So in order to have safe sex and promote healthy sexual relationships, we need to be sex positive. Sex positivity is all about adapting and promoting an open and progressive attitude about sex. It's also about forgetting the feeling of shame and just getting comfortable with yourself and celebrating your sexual identity, and just coming to terms with the fact that you are a sexual being. Once we can really open up with ourselves and get comfortable with having these conversations surrounding sex, sexual orientation, gender identity, intimate and or sexual relationships, as well as consent, we can really learn and appreciate what a gift it is to be able to experience these things. Here at SWAC, which is Students in Wellness and Accessibility Center, and HRE, aka Brock Human Rights and Equity, we want to promote sex positivity and healthy consensual relationships. And what better way to do that than to start an open conversation where you folks can ask any questions that you have surrounding sex and relationships. So like I said before, this is, well, actually I didn't say this before, but this is a safe space. So all the questions that you ask are welcome. There's nothing that is too taboo or too wrong to ask. This is just a purely educational experience. And we have a lot of people here that are very experienced in sexual relationships and in sex. So I think it's a really great time to ask them anything that you feel that you want to know. And like I said, like if you start feeling uncomfortable, just go to the link in the chat, and you can be able to press on the first link to get a support person if you ever need those kind of supports during this session. And one last thing for accessibility, if anyone needs to use live captions, there's an option to use captioning through this event. I don't know if anyone's screen looks like mine, but if you go to the corner or wherever your hand is, you click those three dots that are right next to it. You scroll down and you press turn on live captions, and then you're going to be able to read what people are saying throughout this panel. Alrighty, so, all right, so without any further delay, let's start off with the first question. So this question is actually revolving consent. So I'm going to ask Kellen for her input here. Can you please explain what consent involves?
Yeah, for sure. So there's actually really easy, or there's like a fun sort of example that we use, which is fries. So essentially consent is something that's freely given, right? It is reversible. It can be taken back at any moment. It's informed, it's enthusiastic, and it's specific. There's a really great video on our website actually that sort of explains what consent is in a really simple way, and it uses tea as an example. So with that, it's that, like let's say like we're not talking about sex, we're just talking, you're at my house and I ask you if you'd like a cup of tea, and when you're incredibly enthusiastic, you're like, oh yes, I would love a cup of tea. Then I know that you want a cup of tea. And if you're hesitant, and you're not sure, then sure, I can make you a cup of tea, or maybe I don't, but you might not drink it. If you don't drink it, like I won't force you to drink it. And, you know, I might have boiled the kettle, I might have gotten the tea bag, put it in the cup, got some milk and sugar. I might have gotten all of that or done all of that preparatory work, but I'm not entitled to watch you drink the tea. So if you say no, thank you, I won't make you tea at all. You know, while it's boiling, you might decide, nope, I don't actually want a cup anymore. I can even put it down right in front of you. And you can still say, nope, that's okay. I actually don't want that anymore. And essentially that example really just puts it in terms that make it easy for people to understand, which is that there's no sense of entitlement even if you've done something, or you can choose what you want at any time, and sort of check in with yourself to see what it is that you want. I guess even in a more extreme sense, which is, let's say that person is asleep or they're no longer conscious, the idea of making them drink tea while they're unconscious sounds absolutely ridiculous. You would never do that. That's not something that seems okay in any way, shape, or form. So that's a way of looking at it to make it very clear that, you know, consent is affirmative. It's clear, it's ongoing, it's clear-headed, it's sober, and it's uncoerced. There's a freedom there.
That's very good. Yes, I completely agree. I think it's important to, even outside of sexual relationships, to practice consent as well. Other panelists, Heather, Dr. Dragon, you guys have any input in that as well?
I mean, no, that's the classic example that I use in teaching as well. It's the, like, unconscious people can't have tea, so don't force them to have tea. It's the same.
Exactly.
Yeah. So it's this great video, and genuinely I encourage everyone to watch it, because it does make it very clear. Like, it's the same comparison. If there's something that you want but the other person doesn't, they're under no obligation to be forced to consume the thing that you want. It's straightforward, and it's as simple as that. And the acronym FRIES, I think that's the one that Planned Parenthood uses. It's the same thing. It's freely given, it's reversible, and, you know, it explains it in a nice, really simple way that, yeah, you can say no, and it's you. This is your sexuality, your sexual expression. You're under no obligation to say yes just because, you know, oh, well, it might be convenient. That leads to a whole other issue of, like, implied consent and a whole bunch of other things. But it all boils down to the fact that, you know, this is your choice. You have to say yes or no, and you have to know what you're getting involved into. But that's pretty much it.
Awesome, awesome. Okay, so we can jump to the next question then. We do have a lot of questions to get through, but it's all right. That's a good thing, actually. So here's the next question. This one's actually regarding STI testing. This student is asking, where can I get STI testing done since many places are shut down from COVID? So Heather, maybe you might know that answer.
Yeah, definitely I can answer that. So there's through Student Health Services, there are still appointments available for students. So if just calling the extension 3243 to book an appointment, you can speak with a physician or a nurse practitioner over the phone. And then there's sort of a process involved in terms of getting the test, so sending a lab requisition for you. And then you're able to go to a lab that's close to you to have that test done. There are, of course, your own family doctor is likely doing some type of model similar to that, with telephone visits and a combination of in-person visits. So if at Brock, if an in-person visit is needed, then the physician or the NP on the phone with you can determine that, and we can do some testing in the clinic for you. But if it's a urine test, then that's something that you can do at a laboratory on your own time. And then there's also, of course, walk-in clinics that are open and operating, particularly in the St. Catharines area, that are available for you as well.
Awesome. Thank you so much. That's very important information. So we can go jump into the next question. This is actually probably another health-related question as well, but is it okay to use male and female condoms at the same time for extra protection?
That's a great question, and it sounds like it works. It would work, but it's really not a recommended practice. You should never use more than one condom at a time. So whether that's 2 male condoms at a time or a male and female condom, the issue is that the 2 condoms can sort of interfere with each other, causing some friction. They can slip and slide, and it can also increase weakening of the material, and that can lead to increased chance that the condom might break. So one condom is the recommended way to go.
Sounds good. Thank you very much. So there's also a drop-in testing at the Hub outside of Marketplace as well. It usually takes place on Thursdays from 12 to 3, and that should be hopefully starting soon. So stay tuned for more details. Thank you, Heather, for your answers. So we can jump into the next question. This question might be more, we'll see, I'll just ask it. How do I tell my partner that they're not satisfying me in bed without making them feel bad? And how do I find out what I like to do in bed?
I feel like this is one that's directed towards me.
You doctor.
Yeah. I mean, this is a great question, and it's one that a lot of people come in for things like sex therapy, whether they've been together for a long time or even new couples. But essentially, it boils down to having good communication, good listening skills, and getting over this awkwardness that, like, hey, there's something that I want to do, but I don't want to let the other person down, or I don't want to make it seem like awkward or that they're not good enough. And we tend to be like really critical about all of these things because it is so personal, and sometimes it's kind of weird, right? It's like, hey, I want to do this thing and it involves this toy or this maneuver, and I don't know if my partner is going to be into this. There's all that trepidation. So I guess, to make it as simple as I possibly can, how do you frame it about, not what's wrong, but how can things be better? So, not saying like, oh, you need to do this, or, oh, it could be, that there's a problem here, to try to avoid that kind of negative language, and making it more about like, hey, you know what? I would really like to try something. Like, I've been thinking about this, or there's this sensation that, I think would be kind of fun to feel. And I'm really, excited to try it with you. And to really make it about not just, like your own personal needs, but something that both of you can explore together and kind of engage in together. And that can even open up a conversation about, well, how can we get to this point where, I'm feeling something, maybe there's something that you're looking forward to. Could we negotiate something that helps both of us kind of get to those similar points that we're looking for? And it can be kind of an exciting thing, and somewhat inspiring. And a lot of people, once they start thinking in those terms of like, how can we work together? How can we frame it about, building on something rather than trying to like, oh, correct something? It makes the conversation a lot easier and a lot better. And then the whole second part about, self-exploration. I mean, that's such an interesting one. Because it's like, how do I know what I like? You don't until you try something. So there are some like basic exercises that, people can try. And a lot of it has to do about, things like touch. So we use exercises like, they're called sensate focus exercises. Essentially, it's like, how do I, explore what feels nice just on my skin, on my body, without any judgment? And there's like these structured exercises that you can do, and they're gradual. And it's very much about being mindful, trying to be in the moment, and just kind of feeling like, well, how does this sensation, how does this sense of touch feel? How does it make me feel? What's the sort of impression I get? I mean, touch is such a wonderful sense. There's so many different types. So you have, like pressure and vibration, and even certain sex toys are kind of developed with those differences in mind to try and play on those different sensations. So oftentimes, words like harder, faster, stronger, slower, lighter, they're all great descriptors of how you can touch in different ways. And even just sort of exploring those senses on your own self without the pressure of anyone being there. And then if it is something about, wanting to try it with someone else, you can kind of take turns touching each other and trying to use the same technique of like, hey, let me go from head to toe and touch you and see what feels good. You can kind of be involved and let me know, how does this make you feel? But not putting any pressure that it has to lead to like an orgasm or some aspect of sex. Just, hey, let's focus on just what feels good right in the moment. And that can be a really powerful, great way to explore together, as well as learn, hey, there's some new things I want to try.
Awesome. Thank you. Yeah, it can be a very awkward discussion. So I'm glad you're able to provide some advice on how people can be able to make these discussions less awkward. We also have another question. I think, yeah, this question is definitely for you as well. But before I start, does anyone else have anything to add? Any other panelists want to add anything? Nope. All right. So here's another question for Dr. Dragon. How do you have a conversation about kinks with a new partner? Is it better to talk about this later on or during a hookup?
I mean, great question. Kinks are, how do I put this? They can be super fun. And it kind of goes back to the whole communication thing. Like, how do I, how do I talk to someone without making it awkward, and how do I go about this effectively? There's a lot of different things that could play into how this is going to go. I'm going to frame it in a way that I'm going to try to simplify it as best I can. If we talk about kinks, it is about trust. So it is about building trust. If we're talking about something that you want to do with a new partner, and like, hey, bringing up in the middle of dinner that you want to try something with a wheel of cheese and a spatula, and then there's this goat in the backyard that you keep, can be a little bit daunting on a first date. So it's one of those, like, okay, do I ease them into this? Seems so out of left field. I don't know how to approach this. But I think there's all sorts of strategies and ways that, when we're talking about getting to know each other, making lists of what kind of things interest you. And I think there's an app called Please Please Me, like PLSME, that each partner can sort of, in their own time, privately, write down the kind of things and check off the things that they're into, that they would like to do. And you kind of sort of have this overlap. So each partner does their own thing, and the app tells both of you where you have overlap. So things like, oh, hey, I never knew that you would be into that. That's cool. Let's talk about that. And it gives you something to kind of pursue further. For people in longer term relationships, sometimes it's nice to be able to just write things down on a list and kind of just explore that together. Some people really enjoy, in particular, if you're already doing certain things like watching some sort of media or, some sort of explicit content together. Some people enjoy that. Maybe it's like, hey, there's some things here that I'd like to try, or I really enjoyed, when, this scene, that thing happened. Oh, that's cool. So just bringing it up kind of in those things of what it is that you're like to explore, or what you're willing to try, and kind of like, hey, is there a creative way that we could maybe incorporate this? I'd really like to try that. But if it's something that's just kind of dropped that might seem a little bit daunting, it can seem a bit like, whoa, okay, that's a lot to take in all at once. I know that's always a sort of awkward thing. So really making it about like, hey, I like having these kinds of sensations or these experiences, what's your take on this? And then sort of gradually building up like, well, the way that I can feel that sensation, or the way I like to experience that kind of thing, I like to use these types of, techniques, or these types of methods. Can help sort of bridge the gap. So it's not just all kind of like, hey, I have this suit in this closet that has plenty of leather and a ball gag. Can you wear it for me, please? Probably not an effective strategy.
Yeah. Well, awesome answer. Yes, thank you for the advice. I'm sure a lot of people would really need that. So I'm going to jump into the next question. This question is for Heather. Is it true that condoms can be too small for guys?
Good question. So it's definitely important to have a good fit with a condom, whether it's too small or too big. Can really affect how effective the condom is. So, something that's too big, for example, could slip off, and that wouldn't be very effective at all. A too small condom might sort of be more interfering in terms of the feeling during a sexual activity. So whether it be uncomfortable or get in the way, and that would certainly ruin the experience for somebody involved with that. So definitely size is something to consider.
That's a good thing to know, because protection is very much important. I also have another question for you as well. But it's STI related, but just for the record, what I mentioned earlier about the hub doing they're going to start doing STI testing soon, starting Thursdays. eventually when they announce it. But it is for students on campus, but you can go to campus and get tested as well if you happen to be on campus. And all you have to do is tell security that you're going to go to the hub and you can get your STI testing done then. So leading into this next question for Heather, could you get an STI from doing anal?
That's a great question. And we get questions often about doing oral sex as well and what's transmitted. So it's kind of a short answer and a yes answer, or a short answer and a long answer. So the short answer is yes. The long answer is there's really two ways that STDs or STIs are transmitted. So some diseases like HIV or gonorrhea, chlamydia are transmitted when infected urethra or vaginal secretions contact mucosal surfaces. So like the urethra, the vagina, the cervix. And other diseases like genital ulcers, herpes, syphilis, for example, and HPV are primarily transmitted through contact with infected skin or mucosal surfaces. So that can happen during any type of sexual activity where mucuses are touching mucuses, for example, or where skin is touching skin. We've talked a lot about condoms, and I think everybody knows that condoms can really help prevent some of those sexually transmitted infections, but they don't necessarily prevent all sexually transmitted infections. For example, HPV, if the warts are on the outside of the genitalia where the condom's not covering. So definitely you can get STIs through various types of sexual activity, and you can have some of these diseases in the anus, some of them in the throat or in the vagina or the penis as well.
Thank you. Thank you. So there's a lot of ways they can get STIs. So everyone be safe and be protected. In relation to being safe, we have another question. This question could be for everyone, but we'll see. I'll start off with Heather again, but how can you safely have sex with people or hook up with people during the pandemic?
Yeah, it's a great question. And I don't know if anybody saw some of the stuff in the news about wearing masks during sexual activity. And I don't know if maybe Dr. Dragon has some input on how to be intimate during the pandemic. I mean, there's definitely lots to consider in terms of COVID risk and COVID symptoms and those type of things. So I think being open with sexual partners in terms of, activity, what types of COVID isolations, so if we're just talking about COVID specifically and risk of exposure to COVID. So just being open in terms of, what your activities are. If you were at a party last weekend and or your partner was at a party last weekend, that might increase your likelihood of getting or being exposed to COVID. So those types of things I think are important to think about when you're hooking up. There was lots of talk about, wearing masks during sexual activity, and I'd be interested to hear what others have to say about that as well.
I mean, Dr. Tan made a good point. We're trying to prevent the spread of respiratory droplets, and I know a lot of people may like wearing masks. It seems ridiculous, and then there's the jokes of, well, I've been married for 40 years. My wife always tells me to put something over my head whenever we do stuff. But I mean, it is a good point, just like you would wear any kind of barrier protection to prevent, mucosal transmission of STIs. We're talking about a respiratory disease, so why not use some sort of barrier to prevent respiratory droplet transmission? It makes sense. I haven't seen any studies yet that talk about the effectiveness, in particular when like hooking up. I think it'd be a great and interesting study to do. I don't know how we'd be able to find the participants for it. I mean, still, it's just one of those things that's going in the back of my mind thinking it would be great. But I mean, it's kind of a logical thing to do, especially if you are hooking up. And that kind of goes into, even if you've had a long-term partner, but, they are going out to a party and then they come back, well, that could potentially increase your risk. And, there's this idea too, well, that, a lot of younger people, the symptoms aren't as bad. But at the same time, we've had reports of younger people dying from COVID. So, I mean, it's still like a very important thing to consider. To kind of maybe sidetrack a little bit, if you aren't comfortable wearing that mask or it just seems a little bit too weird, I suppose the other method is, okay, well, how do we avoid that kind of, direct contact from each other's faces? Is this something that maybe, especially if there's a lot of heavy breathing and whatnot, do we like try doing different positions? Do we face more away from each other now? Maybe it allows you to be creative in a sense too, if you're sort of willing to experiment with that sort of thing. And certainly, when it comes to any sort of protection and when it comes to consent, if you're not comfortable with the fact that, well, your partner was, say, at a party and you feel that, well, that could be risky for you, you have that right, and absolutely it's your health. You should be able to say, no, I don't want to do it unless, we're going to meet these parameters. Then I'll feel a lot better. Even if it's, reducing some of the risk, it might make you feel better, and you can actually then enjoy the experience, although you might be sacrificing certain other comforts. So it's a give and take. It's, no one's going to force you to wear a mask during sex or during a hookup. But it's all about finding that balance and what's comfortable for you. But certainly trying to prevent as much spread as we can. I think a lot of people are sort of thinking, well, if you're just hanging out in your social bubbles and you're not really going out too much, I think a lot of sort of health professionals are thinking that, well, folks won't be hooking up as much. But I don't know. I think if people have the urge and the need and they feel like they want to, they will go out and do that. So I don't know what would be a truly effective strategy. And it's kind of a weird and interesting time for all of this.
Yeah, I completely agree. Thanks for that, Dr. Dragon. I think Dr. Tam had, some good recommendations when she was talking about masking during sex. And I know it can be sort of a funny thing to think about, but certainly I think if you want your partner to wear a mask, I think it's important, and you yourself wear a mask, I think it's important to have that conversation about how can we both be safe and intimate at the same time. And being intimate doesn't necessarily mean sexual activity within 6 feet from each other. So there are all different ways to engage in intimate activities with somebody else and still be safe at the same time. And maybe we'll talk about that later on in the discussion. But I think it's always better to be safe rather than sorry, and whatever that might look like might be different for different people. But definitely the recommendations coming from Dr. Tam and from public health are grounded in what's safe for everybody.
Awesome answers. Actually, you guys kind of predicted the next question, because this question is pertaining to how to stay connected in a long distance relationship during the pandemic. And you guys kind of stated a few, but other suggestions of intimacy activities during this time. I'll let Dr. Dragon, if you seem like you want to could answer it.
Sure, just throw it all on me. It's okay. I'm used to it. To be honest, I have a friend and a colleague. She does life coaching. I can provide the link perhaps. She posted on her blog. She's currently in a long distance relationship with her partner. He's in the UK, she's in Toronto, and the experience for her has been quite unique. And she wrote a whole post about this, and I love all the ideas that she's shared, because there's a lot of great just fantastic and creative ways that you can still be intimate. And I think it's one of those things where a lot of people forget that, intimacy isn't just about sex. Sex is a very small part of intimacy, and intimacy is just a relatively small part of communicating with someone. This idea that you can feel close to someone, well, sure, there's physical proximity, but then there's that sort of emotional component. And then the sexual component, well, yeah, the distance thing is kind of difficult, but there's still ways to sort of express your sexuality, your desires, and even engage in a few different behaviors that can be kind of creative and fun, that, the use of a webcam can aid with. You don't need to have an OnlyFans account, something that just the two of you can have if that's what you're into. But it's one of those things where she goes on and talks about sharing a podcast or reading a book together, and then sort of just commenting about it, just to kind of get where your head is at and where the other person's head is at, and just creating these fun games. So they'll do puzzles or do other little seemingly trivial things, But putting that effort in and making it so that, hey, this is for us to connect, and having that purpose of we are connecting with each other. And then there's that sort of ultimate ulterior motive of we're doing this because we want to feel close with each other despite that distance, is huge. And she lists a ton of different and great suggestions. So I'm very happy to provide a link to her post.
Thank you. Thank you very much. We're welcome to drop it in the chat if you want to.
Yeah, I'll do that now.
Heather, would you like to, do you have anything you want to add to that, or Kellen?
Yeah, I think it's just important to experiment with each other and see what works for both of you. You know, because it might be something that you've not experienced before, living apart or not being in close proximity with a partner. And so experimenting and finding what works best for both of you can be fun.
Awesome.
Yeah, no, I guess the only thing I would say is just that, yeah, it really does essentially come down to communication. Because yes, there is COVID, but people have been doing long distance relationships forever, right? So that aspect isn't new so much as maybe the prevalence of it now, and the fact that there is more social distancing and more isolation in that respect. But yeah, I think that we just have to be open to the idea that this isn't really going to go away, and that might change how our relationships look in the future. So it might, right? Like the idea of wearing a mask during sex sounds crazy, but maybe in a few years, not so much. So we just have to really be open, I think, to new ways of being.
Interesting. Yeah, we have to just keep up with the times. So we can jump in with the next question. Thank you guys for your answers and expertise. This question is more health related, so I'll be asking it to Heather. Can my girlfriend get pregnant if we have sex when she's on her period?
So the short answer is yes. And there's lots of myths about this, but it's totally possible. So the problem is a very lengthy answer, but I'll try and shorten it and make it a little bit more short and simpler. But essentially, bleeding can be anything, not just a period. So it is possible to have some bleeding around the time of ovulation, which is when an egg is released from the ovaries. And if that comes in contact with sperm, then a pregnancy can happen. Typically, ovulation occurs within around sort of day 14 of a woman's cycle. So day 1 being the start of a period. But that can be different for everybody. People who have a shorter menstrual cycle, for example, could ovulate around day 7. So that might be at the end of somebody's period, for example, when bleeding is still happening. So pregnancy could be possible at that time. The other thing to think about is that the ability to conceive is really quite miraculous, and it requires the meeting of the sperm and the egg, and the sperm can actually live inside the vagina or vaginal cavity for up to 3 days. So if that's present during ovulation, then a pregnancy can happen. So really, the most effective way to prevent pregnancy, obviously, is abstinence, but condoms can really help, or contraceptive methods are really your best bet in terms of preventing pregnancy, rather than relying on somebody's menstrual cycle.
Awesome, thank you. Anyone else would like to share any other answers? Pretty good answer there.
That's pretty good, other than, I mean, sperm are sneaky bastards. They'll hang around and they'll wait for that moment to strike when you least expect it. So it's better to be cautious in this case, and as Heather mentioned, you can get all sorts of false signs, and ovulation and menstruation, they don't always coincide when you expect them to. So it's always something to keep in mind, that it's never a clear and perfect sign. Oh, this happened, therefore no problems. So the short answer is yes, you could get pregnant if you're still on your period, but the complex answer is maybe.
Yeah, absolutely. And keep in mind that there's other reasons that bleeding can happen. So it might not necessarily be the menstrual cycle. So that start of menstruation that is causing the bleeding. And if you have sex before you realize that, then it might be too late to prevent the pregnancy.
That's very good to know. Thank you. So we can jump into the next question. Should you be concerned if your partner has a higher sex drive than you? I'll ask that to Dr. Dragon.
Yeah, that's going for me. Concerned? No. Intrigued? Yes. I'll try and explain why. I mean, the thing is, I don't think any two people are going to have exactly matching sex drives. There are so many factors that do affect a person's desire and their drive. And they shift. They're always shifting. You'll get people who have slightly higher at certain seasons and others who are lower. And that's, constantly changing and fluctuating. So I think when it comes down to someone who has, a desire for it, and when the thinking comes to mind, well, the only way to satiate or satisfy my drive or my desire is only through partnered intercourse, I think that's where the concern should be coming in because, well, okay, maybe I, as an individual, have a lower sex drive compared to my partner, but that doesn't mean that my partner can't engage in some sort of self-stimulation or other things that don't necessarily require my full and engaged participation. So again, it's this sort of, just because they have a higher drive isn't necessarily a bad thing. It could lead to sort of like interesting exchanges. But I think it sort of merits some sort of investigation. It's like, oh, okay, so the fact that you do have this drive, like even talking about it and being able to sort of figure out, what sort of things do you like, do you enjoy, what kind of things help you to feel like we are connected? Is it something that's purely just physical? Is there like an emotional component too? And just having discussions about it can be really, really good. And that sort of second point of, it doesn't always have to be partnered activity. And there's even varying degrees of partnered activity too. So I think that's something to keep in mind.
That's awesome. Thank you. Anyone else would like to add their input for the answer?
I could just say that I think it's important to remember that it's normal for everybody to have a different sex drive, or what we would say is libido. And there's different things that can affect somebody's libido. So yeah, it can change throughout the day. It can change throughout the week. It can change throughout the month. It can change with particular medications or particular things going on in somebody's life. And so I think it's important to remember that I think maybe it would be, it's normal to have a different sex drive or a different libido than somebody else. And that makes sense. That's what makes us human. We're all different for different reasons. So I think it's important to remember that. And if it's something that is concerning you, that your sex drive is different from your partner's sex drive, maybe it means having a conversation about that and just say, this is the way I'm feeling and I wonder what you think. And, where can we go from here? So that you're both comfortable and being with each other in that way.
Awesome. Thank you for your insight. So it seems to be that communication is definitely the key in maintaining healthy relationships for sure. All right. So I have another question. I feel like this question everyone can answer for sure. We'll see who goes first, but I'm dealing with realizing that I'm very attracted to women while dating a man. How do I bring this up? I'm not interested in ending things with my current partner, but I want to figure out where I'm at, maybe exploring my newfound bisexuality somehow. Any thoughts or resources? I will start off with Dr. Dragon, and then we can kind of go from there.
Sure. I mean, it's one of those things where people, when they are at a certain age where they're exploring their identity, they're trying to figure out where you're at, and we're constantly faced with this idea that people belong in certain categories, or gay, straight, bi. But the thing is, we're a lot more flexible than we realize. There's a lot of gray area when it comes to attraction and orientation and all of these factors. And the more we research it, the more we realize this is really, really complex. So I just want to preface by saying there's a lot that could be potentially going on. As far as like exploring that, it's difficult to just drop that on a partner because, they may have gone into a relationship expecting certain things and now those expectations have changed. And, does that put your relationship at risk? And potentially, yeah, it could. And, to them, they might think like, hey, wait a minute, maybe this is a great way to spice things up. Maybe I can get something extra out of this, which is kind of selfish and maybe not the way that ideally they would like to respond. But I just want to be able to say, getting to that point where, okay, I'm thinking about this, I want to explore more of this and explore who I am. There's certain things that you can read about and read other people's experiences. And some people will suggest, hey, there's no other way other than maybe trying it and seeing for yourself if this is what you want to do. And that puts people into a really tough position because do I maintain the relationship? Like, I don't want to lose my partner. But at the same time, I feel like there's this other component, this other part of me that would want to explore that. I think because we're talking about a relationship where the expectations were sort of set and now they're changed, it's really important to communicate to a partner how the expectations of the relationship have changed. So to be able to be forthcoming and sort of brave and open and honest enough and really like vulnerable enough to say to someone, hey, the dynamics of our relationship, they're changing. There's these other things that I have in mind of where I would want to see a relationship currently go, and we need to talk about this, or I'd really like to, just kind of tell you what's on my mind. And how a partner responds, I have no way to predict. Some people will take this quite well, others will get upset, and then there's everything else in between. So really, I think you owe it to yourself and to your partner to really just say what your expectations were, how they've changed, and what you think are potential outcomes. And to really get their feedback so that you're not just dumping on them like, oh, here's how I want things to go, and they're no longer part of that process. You're just sort of laying it out. But to really make them a part of it as best as you can. So to even just get their feedback, their thoughts. What would they think about the dynamics of a relationship and those expectations changing? What sort of expectations did they have in the first place? And now that you've brought this up, how does that impact what they were planning or thinking of in terms of this relationship? So that's the sort of first step. And then okay, let's say everything goes according to plan and it's the ideal situation where they're totally cool with it. And it's like, yes, let's bring someone else into the relationship. That's a whole other can of worms that you're opening up. But at least, getting that conversation started of just the expectations is going to be a huge step. And I think something that most people really should focus on for that first little part.
Thank you. That's an awesome answer. Anyone else would like to add their insight as well?
The only other thing that I might add, I think the question asked about some resources. I like the sexandyou.ca website. I don't know what others think about it, but it's got lots of great information about most of the things that we're talking about today. So there's a human body section, sexual activity section. There's an LGBTQ section as well. It talks about STIs, contraception. So I can post the link in the chat box, but there's lots of really good information on there.
Awesome. Thank you for those resources. You can also drop that in the chat too if you want to drop a website there. Okay, awesome. These are very good answers. And also thank you to students for sending in these really great questions as well. All right, so we can go to the next question. This is more of a medical and clinical question. So what can I do if my male partner cannot climax or ejaculate for the first past years, very often, weeks on end, trying both partnered or solo, and refuses to speak to his doctor about it? So I could ask Dr. Dragon if he wants to share insights.
Sure. So it sounds, again, I'm not making an official diagnosis. It sounds similar to what we would call like a delayed ejaculation. Meaning, the ejaculation either doesn't happen or happens much later than the sufficient stimulation that you would think required would get you to. So a lot of it has to do with well, sufficient stimulation. And part of that is kind of discovering not just the physical elements that are required, but also the sort of comfortable elements. And there's a whole bunch of physiology that's involved in like reaching an orgasm, for instance. So your nervous system divided into two parts, and each part plays a role either in getting aroused and then ejaculation. So the parasympathetics, that helps with arousal. That's mostly what the signaling is for. And then the sympathetics, that's your the same as the fight or flight response. That's in charge of your, orgasm and everything else. So a lot of the time, where people are having issues with delayed orgasm, it seems to be, again, the majority of the time, it's insufficient stimulation, whether that is physical or some sort of emotional or cognitive stimulation. So a lot of it has to do with kind of getting a little bit more relaxed, finding that sort of headspace where you feel things are good, you're getting your rhythm and everything else. But usually, if that's not enough, there is a sort of process in therapy that really goes in and tries to eliminate some of the other potential factors. And then being able to seek a physician's help can be helpful too, because sometimes it can be indicative of other things going on. So it really depends, and it's extremely variable, and I can't say with any sense of confidence what's going on in this particular situation. But it comes down to, if someone is kind of embarrassed or shy, you can't force anyone to go seek help. The best you can do is to help support them and maybe encourage them, and be as supportive as you can in terms of, what it is that you can do as a partner. But ultimately, that decision is up to them to, hey, this is enough of a problem that I need to figure out what's going on. But again, it doesn't have to be anything, surgery is usually that sort of last resort. But sometimes just being able to talk about it with someone who has, appropriate context, has an understanding of, what that person's experiences are like, and finding ways to help get them sort of relaxed and comfortable, and finding, hey, what's the right stimulation that you need to get to that point? That's typically what's been most helpful for most individuals in that situation.
Thank you. Awesome. Heather, would you like to add anything to that as well?
Oh, I think that was a really great, and I don't think I would say much different than what Dr. Dragon said. It's difficult for any type of health issue if there's somebody who is concerned and the other person is not. You can't force somebody to go to see a doctor or nurse practitioner about something. And so just being, just voicing your concerns and then being supportive with that person's decisions is sort of what all that you can really do at that point. But being open about your concerns with a partner, exploring some options to try and resolve that. And remember, we talked about different ways of being intimate with somebody. So being intimate doesn't necessarily mean that climax has to happen. So there's lots of other things that you can do together, and exploring that together is something that you could bring up with your partner, and then just waiting for your partner to maybe be ready to have that conversation with a physician or with a nurse practitioner. Might take a little bit of time to come around to that idea.
Yeah, and just one other thing, if I can add, a lot of people feel that orgasm is the goal of sex. It's not. It's a happy bonus. And I think when people focus on orgasm being the goal, that's when a lot of other problems occur too. It's very performance based, and that shouldn't be the goal of sex. The goal of sex is intimacy and connection, and there's so many different ways to feel connected to someone else. They don't always involve an orgasm. If it does, great. If it doesn't, it should still be a satisfying experience. So I'll often tell people, if the point of sex is to have fun and enjoy it, this doesn't sound like you're having fun. So what ways can we focus on that is actually fun for the both of you, rather than just trying to, reach this, I had an orgasm, therefore I had sex and it was successful.
It's very interesting. It's a change of mentality.
Yeah.
Well, I'm going to jump into our next question. This question is for Kellen. This question is kind of based around consent. And what it's asking, the student is asking, is it consensual if drunk people have sex with each other, even if we're both drunk?
Yeah, I found that to be like a tricky, interesting question. But in terms of what I'm aware of and in my understanding of consent is that, you both people have to agree by choice, but they also have to have the freedom and the capacity to choose. And when you talk about substance use, that can hinder your ability to make a clear decision. So I guess in terms of, well, one, I guess there's always the idea that there is somebody else more intoxicated than I am, maybe, or vice versa. So I'm immediately starting to think, well, do I even feel clear-headed? Like, do I even feel like I'm in a position to make, I don't know, to feel comfortable with my choice? So that's one of the first things that I'm thinking about. In that you essentially like really need to be sober enough to know what's going on, and then also make sure that your partner also feels that way. So I guess I would love some other input as well when it comes to this question, as I've only really thought about it in terms of a difference between the two people involved and not so much both being intoxicated, if that makes sense. Does that make sense?
It definitely comes down to the capacity to make an informed decision. So much like we might argue, well, someone who's had a few drinks and is drunk, are they able to drive? Sure, they might be able to, but does that mean that they should? Because that capacity to evaluate, how well you can drive, and your capacity to stay safe and not endanger others, that is now that's challenged because you are intoxicated. We have studies that indicate some of those higher level functioning aspects of your lovely organ that is your brain are impaired. Why we call it impaired driving. You really don't have that capacity to make good decisions. And also for any of those who have gone to Isaac's on a Thursday, you see a lot of impaired decision making there. And it's not really fair to say, well, we're both in the same state, therefore it somehow cancels out. I don't think so, because now it just means that both of you are impaired and not really making the right decision. So ultimately, it's a situation that you would like to avoid, because just that capacity, you're not really informed, you're not really evaluating all of the potential risks that are involved. It's kind of, you're just dismissing, you're taking higher risk behavior. So it puts you in a bit of a vulnerable position.
Yeah, is it sort of fair to say then that, like, if it's involved, like, right, to assume no, almost, like, instead of going into thinking, hey, maybe like, maybe not, like, maybe there, does that make sense?
Yeah, I see where you're going with this, and I guess if you were to take it back to like the FRIES acronym, right? Sure, we could argue that it's freely given. Yeah, of course I'll do that with your penis. It's great. Sounds like a great idea.
Too. Yeah.
Yeah, right. It's great. Is it reversible? I guess. Is it informed though? That one's a little bit trickier, and it could be enthusiastic, but do you really know what you're getting into? Are you, as the experience is ongoing, do you have the capacity to say, hey, we sort of thought going into this, we wanted the tea, but it's not tea. I kind of want coffee now. It's like, I guess whatever, I don't care. Was that fair? I mean, it gets really complex. So I think, like you had suggested, maybe erring on like, we're not at that best line of thinking. Let's err on the maybe not side, because beyond that, no, that doesn't sound very fair.
Awesome.
Thanks for your, oh, sorry, Heather, go ahead.
That's okay. I was going to say, I completely agree. And I think you raised some really important points about, being impaired for one, and the risks that are involved with that. So the problem with being intoxicated, whether it's being drunk or under the influence of another substance, is that our brain works differently. We can often be very disinhibited, which means that we make decisions differently than we would when we weren't intoxicated. And the risk that it is that, it might lead to a higher chance of sexually transmitted infections because people aren't as careful. It could add more potential to lead to a pregnancy because we're not as careful. fearful, and it can lead to intimidating situations, coercion or violence, when both people are intoxicated. So I think it's you got to take into consideration that safety piece as well, that things can get out of hand really quickly when people are intoxicated.
Oh yeah, I think Eve is having some technical
try this
difficulties.
again.
Yeah, is it working out for you now, Eve? No, she's heading out. That's sort of it, what we have for time. And unfortunately, Eve's dealing with some technical difficulties right at the end here. But yeah, thank you very much for all of your insights on this. It was really awesome to get these questions from students and hear what the questions are of students that are on our campus. Yeah, thank you very much for taking the time. Thank you to all the attendees for joining. Please feel free to check in on the links that are in the chat. We do have peer-to-peer drop-in hours weekly through the HRE department if there's anything that you want to discuss further, or reach out if you have any specific questions or concerns. We're planning on posting this video on our social media and on our website so that people can revisit this as we go forward. So yeah, thank you everyone for attending and have a lovely evening.
Oh, I guess I do have one question too, which is if people did submit questions that didn't get answered, what should they do, or where should they look?
Yeah, feel free to keep submitting questions if there's still sort of burning questions on your mind, and we're sort of going to put together a social media post, and we'll try and address as many as we can just to make sure that everyone feels like they've been heard and have their questions responded to. Yeah, so thanks. Eve, you're back. You can.
Yes, guys, I don't know what happened. Technology just betrayed me, like just in ways I can't even imagine. But thank you so much for thank you, Hannah, for taking over. Thank you. Oh my gosh, I don't know what just happened like 10 seconds ago. But well, now I feel bad. I missed like the rest of your answers. But thank you guys so much for answering. I can let Hannah finish the conclusion since she kind of started. I don't know. My internet, I'm betrayed. I really feel betrayed right now.
It's all good. That's basically all we have. But yeah, thank you very much to our panelists, Heather and Dr. Dragon and Kellen. Yeah, have a great evening, everybody.
Thank you.
Thank you. Bye-bye. Stay safe.
Bye.
Yes,
You too.
you too.
Take care.
Stay safe, everyone. Remember, wear a mask and a condom.
Yes.